Are you pregnant? Congratulations! Today in this video we're going to talk about that not so fun pregnancy symptom, morning sickness or pregnancy nausea, because it can go not just in the morning but throughout the day. We are going to talk about how could you possibly prevent it, what are some treatments or remedies to help decrease it, and then what do you do afterwards? What's the recovery? Okay, we're going to talk about all that today, so stay tuned till the end. Hi guys, my name's Haley. I'm a labor and delivery nurse, childbirth educator, certified breastfeeding counselor, doula, and mom of 2. Welcome to Pregnancy, Birth, and Parenting 101, educating and supporting you one video at a time. Okay, today we're going to talk about prevention, treatment, and recovery of pregnancy nausea or morning sickness. So how do we prevent it? Well, first of all, you have to not be pregnant yet to try to prevent it. But if you are not pregnant and you are trying to get pregnant, about a month or 2 before you start trying, go ahead and start taking a prenatal vitamin, just a simple over-the-counter prenatal vitamin paired with a B6 vitamin. Okay, so studies have recently shown that pairing those two together about a month or 2 before you actually start trying to get pregnant can severely decrease or help you avoid nausea in the first trimester. All right, but if you're already pregnant and you are close to 6 weeks, chances are you may be experiencing that. You may be waking up in the morning first thing and feeling like, oh gosh, like I feel like I'm gonna throw up, or I feel really nauseous, or do I have the stomach virus? That may have been the clue to let you know you're pregnant. It comes in all forms at all different times, but it does definitely hit more often when you have an empty stomach. So I liked to have a little something by my bed. Something simple like this Z bar here, this little Z Cliff bar. This is actually my 2-year-old's favorite bar, but I stole it and started putting it by my bed because it definitely helps to just go ahead and put something in your stomach, something that's palatable, something that's pretty, you know, there's not a ton of flavor in it and it's not really high in sugar, but it gives you a little something right away to hold you over until you eat breakfast. And if you're not a breakfast eater, pregnancy will make you a breakfast eater because you need to be eating breakfast. You need to be eating small meals all throughout the day. So when I say a small meal, I mean like a snack, not like, you know, we're not sitting down having a 5-course meal or anything like that, because if your stomach is too empty or if it's too full, it can make the nausea worse. So you just want to keep something on your stomach all throughout the day, and not letting it get completely empty, but not overfilling your tank either. Another thing that's really helpful is having something like a Sprite or a ginger ale or something that has little bubbles and fizzes in it, because that can help settle your stomach as well. A great thing you could do as well is to have some like soda water and put some essential oils like lemon or peppermint or ginger in there and just sip on that throughout the day. In case you're feeling like, oh gosh, I might get sick, I always carry this around with me whenever I'm pregnant and nauseous, because you never know when it's going to hit you. A little trick to the trade as a labor and delivery nurse, what I do for my patients is I take a couple drops of peppermint oil and I just drop it right in here, and a lot of times when they bring it to their face, just smelling that peppermint oil is the difference between them puking or not. So that's not a bad idea. Put a couple drops of peppermint oil, keep this in your purse, in your car, wherever you might be going. All right, another thing is these ginger root pills. So taking those can be really helpful. I, however, had a hard time because they are so large that I just put ginger in my water or made tea and put a little bit of that in there, and that really helped as well. Continuing to take a B6 vitamin with your prenatal vitamin throughout pregnancy helps. And if you're at work and you're not trying to let everyone know you're pregnant already, but you're trying to make it through the day without dry heaving, I really love these just plain peppermints. Just you can suck on them throughout the day. They help to keep the nausea at bay. Look at that, I'm a poet, didn't know it. But little tricks like that are really helpful. Also getting plenty of sleep, exercising, believe it or not, even if you don't feel like it, go for a walk, do some prenatal yoga, or continue your current exercise regimen if it's okay with your provider, because all of those are going to help actually reduce your nausea. Eating healthy, so if you're eating fried foods or high fat foods, those are going to actually make the nausea worse. So you want to think little healthy snacks throughout the day. I personally, when I was pregnant, I liked cold foods. So whether it be cereal, whether it be a cold, caprese sandwich, that was a big one, or like some fresh fruit, that was really helpful. I loved plums throughout my pregnancies, and yeah, you'll kind of find what works for you. Frozen popsicles are great too. Now, this is all for just like the normal morning sickness or pregnancy nausea. But if you're feeling like you can't eat anything, you're losing weight, you're not able to hold down liquids, you feel like you might be dehydrated, all that, you definitely want to consult your care provider. They may want to prescribe something called Zofran. It's a little tiny pill that dissolves underneath your tongue. Worked wonders for me in my first and second pregnancy. And helped me, was the difference between me puking and not. I unfortunately had something that was a little more extreme than the normal pregnancy nausea. I had something called hyperemesis gravida, which I will do another video on, but for right now I kind of want to just stick to that normal pregnancy nausea. But if it is more, if you feel like it's more extreme or it's getting in the way of you being able to work or live your normal life, then talk to your care provider. They may want to provide some Zofran. They may ask you to try some Unisom paired with B6 at night. That can make you drowsy the next day, but it does severely decrease the nausea, and studies have shown that it's very safe and effective in pregnancy. But definitely talk to your care provider anytime you're thinking about taking any over-the-counter medications for nausea or for anything else. And then a little trick of the trade, let's talk about recovery. So once you've gone through this, usually from like 6 weeks to 12 weeks, so about a month to a month and a half of just feeling really nauseous and dealing with that and not wanting to eat, suddenly the nausea is starting to go away, you're getting your appetite back again, you can go out to dinner again, you can go out to brunch again, and all of a sudden you want to eat again, and so you just start to eat and eat and eat. You can really gain a lot of weight during that second trimester easily, because now you can eat again you want to, and it's like something has been deprived from you for like a month to a month and a half, and now you're like, oh yes, I will have that piece of cake, or yes, I will eat that, whatever it is, that fill in the blank that's your favorite thing. So I just tell you to err on the side of caution and say, try to stick to eating healthy. You're still nourishing your body and your baby's body, and you don't want to, American College of Obstetrics and Gynecology, ACOG, recommends that you gain between 25 to 35 pounds during your pregnancy if you were a starting normal weight. So that's kind of a healthy weight gain. So you really don't want to go above that. Studies have shown that it can cause complications, can cause bigger babies, and lots of other things. And it's harder to get off after baby comes out. So 25 to 35 pounds, and we'll talk more about that in another video. But I hope this was helpful for you guys. I hope you're not feeling too nauseous, and some of these tricks of the trade really help you. And hang in there, because I promise it will go away, it will get better, and if it doesn't, definitely talk to your care provider and see if there's anything that they can recommend for you. Please don't forget to like, subscribe, or comment below. Ask any questions you guys have, because I'm here to help and I genuinely want to. Don't forget to follow me on Instagram at Naples Birth Services, and if you're in Southwest Florida and you want labor, birth support, or childbirth education, look me up at naplesbirthservices.com. Alright guys, thank you so much for watching, and remember, you got this.